Neil Ferguson. Transmissibility is this key thing that you're looking to get the answer to. When do you think you will have that answer? And is it really a case, as we were hearing earlier on the programme, which is if it's 50% more transmissible, this variant, that's a little short of a disaster, but 20% we could kind of live with?
So first of all, it's never all or nothing with science. You gain evidence as the data is collected. Certainly, it is much easier to deal with 20, even 30% than it would be 50% or more. The challenge we have, and just to explain to people why this is difficult, I mean, we're tracking this virus, you could say, well, why can't we immediately see how it outcompetes the existing Kent variant? Is because of how it was introduced into the country. It was introduced from overseas, principally into people with Indian ethnicity, a higher chance of living in multi-generational households and often in quite deprived areas with high-density housing. And so we're trying to work out whether the rapid growth we've seen in areas such as Bolton is going to be typical of what we could expect elsewhere, or is really what is called a founder effect, which is often seen in these circumstances. There's a little bit of, I would say, a glimmer of hope from the recent data that whilst the virus, this variant, does still appear to have a significant growth advantage, the magnitude of that advantage seems to have dropped a little bit with the most recent data. So the curves are flattening a little. But it will take more time for us to be definitive about that.
Understood. Now, you mentioned the issue of ethnicity. There is a link often made between ethnicity and willingness to have the vaccine or not. Are you able to tell from the data whether that's playing a role in the fast spread?
So I don't think it's playing a role in the fast, well, not a significant role in the fast spread. As we just heard, I mean, this is virus which is principally circulating among unvaccinated groups. The reason it's important to ensure vaccine uptake is as high as possible in those communities is to protect the people being vaccinated. If you have a lot of virus circulating, that is a risk for people.
OK, and when it comes to travel that you mentioned, it came in from overseas. Do you believe that it is, to use the words of one junior minister yesterday, dangerous for people to travel because they maybe take it elsewhere or they maybe bring a version of it back here?
So I think there's a number of different questions there, and it depends what we want to achieve with our restrictions on travel. Clearly, if we want to stop any new variant coming in, then arguably the sort of strategies that Taiwan and New Zealand and Australia are adopting are what we need to implement here. But I'm not sure if the majority of the population would support that. So, I mean, I think we have a strategy at the moment of trying to reduce the risks but not eliminate them. In terms of personal behaviour, I mean, I think the government recommendations are clear. The green list countries pose less risk than the amber risk countries, but nothing is risk-free.
Well, you say it's clear. I'm finding people are quite confused because the word amber confuses them. They don't even know when they're at a traffic light whether amber means they should prepare to be going or prepare to stop. In fact, I put a little poll out on Twitter. We had 2/3 of people saying they thought it meant stop and 1/3 of people saying they thought it meant go. It's not very clear, is it?
And people have to bear in mind that this is not a panacea. I mean, for instance, home quarantine. I think one thing the import of this Indian variant has shown us, everybody coming back from India had to home quarantine, have to test. I mean, it is an imperfect way. It basically didn't work. It's an imperfect way of stopping viruses coming into the general community. And so, but it probably does have some effect.
Understood. One last then on the list of things that people say you should worry about is lockdowns and local lockdowns. You heard the resistance there from the local council leader. What does the science tell us about whether they did or didn't work when they were done?
So I think they're more effective if they cover wider areas for the reason the council leader just stated. The tier system last October to some extent worked. It slowed spread. The big downside of that is if we feel we're in the position where this variant is substantially more transmissible, and we don't know that yet, but if that is the situation we're in, then locking down hotspot areas, may work in those areas, but just allows the rest of the country to reach a high infection level. And we know what the consequences of that were last year. Now we're in a different situation now. We have high levels of vaccine coverage. So the real challenge for us as scientists and for the government is to try and calculate, is that wall provided by vaccination sufficient for us to keep the consequences of this Indian variant at a manageable level?
And a factor there, I hear, is AstraZeneca. In other words, that AstraZeneca, a vaccine that's highly effective in most cases, there is some suggestion that it may be rather less effective than other vaccines when it comes to dealing with the Indian variant. Can you confirm that that's the evidence? And if so, does it raise issues about what policy should be now?
So it's something which is being studied very carefully. We don't really have enough data to really distinguish between the vaccines. First of all, I should say there's a good deal of confidence, and the data is being gathered, that vaccines will protect against severe disease. I mean, the effect of the Indian variant on the vaccines will be fairly marginal in terms of the protection against severe disease. So vaccines protect individuals. The thing we're slightly concerned about is whether there's an impact on the ability of vaccines to prevent infection or mild disease and therefore prevent transmission in the community. There are some hints, and it's not vaccine specific at the moment, there's some hints in the data of reduced vaccine efficacy against infection, against transmission. But we really have to wait as more data is gathered to be definitive about that. But of course, it's a concern because if we don't have the same action of vaccine, and we'll have some, but same level of action of vaccine and blocking transmission, it's another way for the virus to amplify itself in the community.
And just finally and briefly, if you would, I mean, you don't make policy and you're a scientist who deals with evidence, but I'm going to ask you a hunch. Do you think we'll be fully reopening in June, or do you think we're just going to have to do a little bit of reconsideration here?
I think that's been actively considered. I think it's very much in the balance. The data collected in the next 2 to 3 weeks will determine that.
Professor Neil Ferguson and earlier David Greenhouse, thanks for joining us.
Time now is 21.